I am Dr. Ranjini Raghavan, Senior Consultant ENT Surgeon, Sunrise Hospital, Cochin. You are watching me on webindia123.com. A crying child is often a source of anxiety for parents, and especially when the child is small and is not able to express exactly why the child is crying, it's doubly worrisome for a parent. Ear pain is also a very common cause for crying child. Now, ear pain can occur in any child from the age of a few months to an adult. Now, when the child is crying and you don't know whether it is a ear pain, there are a lot of factors which you should take into consideration. Now, one thing you must remember is that if a child has had a ear infection, there is very often a chance that it can recur again. Studies show that 1 in 4 children below the age of 4 often get a ear infection, and this is often seen in children who are put in daycare, and nowadays with both parents working, that is a very common scenario. It's also seen in children who are breastfed or bottle fed in the lying position. What are the causes for a ear infection? This is the outer ear that we all see, and this is the ear canal. Now, this entire area is called the outer ear or the external ear. Then this whitish area is the eardrum, and this part is called the middle ear. That is the part just behind the eardrum. Now, the middle ear, the outer ear are both causes for ear pain in children. The third cause is referred otalgia. Referred, we call it referred because the cause for the ear pain is outside the ear, but the patient feels that the pain is coming from the ear. So let me enumerate what the causes are. In the external ear or the outer ear, the main causes for a child are, of course, one, it can be just the common wax, which can get impacted because it accumulates to a lot, and sometimes when you are giving a bath or the child goes swimming, the wax that is present would expand, and this causes pain. The second cause is a boil, or what we call as a furuncle in the ear. This is quite often seen if you use earbuds to clean the ear, or if the child has a tendency to put his finger inside the ear, etc. The third cause is what we call as an otitis externa or an ear infection. Here can be either a bacterial infection or a fungal infection. This is also seen when people use earbuds very often, or if you go swimming and their water is infected, things like that, you can get an otitis externa, which is a fungal infection. Then there is another very common cause in children, that is when they introduce something into the ear, which is very often seen like a foreign body, that is some beads or something like that, which can get infected, or even more common if some insect goes into the ear. The insect can be anything. It can be just an ant, a small ant. It can be something like a small cockroach or something, or some insects like that which fly in the night. Any of these can get into the canal, and that also elicits very severe pain in a child. Now, when you go to the eardrum and part behind that causes pain when the child has an infection within, and that is called as either what you have as a acute otitis media, where the drum gets congested and it is painful because there is a lot of pus behind the eardrum and causes the eardrum to bulge outside. This is when the child gets up in the night crying very severely, especially when the child has been having a nasal infection or a cold for a few days, and the parents or the child blows the nose hard to clear it. At that point, the infection goes straight from the nose into the ear, because what most people don't understand is that there is a small tube which goes from behind the nose straight to the ear, and that is usually transmits only air to the ear and helps in the hearing. But when there is a nasal infection, the infection goes straight through the tube into the ear, especially when you blow the nose or when you feed the child in the lying position. This is very common. Then, if the child is having a frequent allergic problem and sneezing and running nose, again this tube can get blocked and you can get what is called as an allergic problem, allergic otitis media. In some children, when this goes on for quite some time, you have what is called as a blue ear also, where the child's hearing comes down markedly, and the parents recognize this only when they find that the child listens to the TV very loudly, or the teachers often complain that there is some slight hearing problem, because the child is often not able to tell you that he or she has a hearing problem. So these are the causes in the middle ear. Now, in referred pain, that is what I talked to you about, areas outside the ear which causes the ear pain. The most common cause is a tonsillitis, because there is a small nerve in the throat which is similar to another nerve in the ear. So when there is a pain in the throat, definitely the child will feel that as a pain in the ear. Then, common ulcers, mouth ulcers that any of us can get, which is called as an Achilles ulcer. If the child gets that on the tongue or on the cheek, they may also get that as a ear pain. Pharyngitis, sinusitis, all these are other factors which can cause this. Now, any dental infection, caries is very common, because now a lot of children get cavities in the tooth because of the eating chocolates, not proper dental hygiene. Painful tooth can often result in earache. Less common causes like the temporomandibular joint, that is the joint just in front of the ear, which helps to open and close the mouth when you're chewing. If there's a small inflammation in that joint, again, because the ear is right next to that jaw, this joint, again, can come present as a earache. And less common if there is a thyroid problem, what is called as an inflammation of the thyroid. Again, the child may come present with a ear pain. So all these are causes of ear pain in children. When the child is having a ear pain, especially when it is only a baby, how can you make out that it is ear pain? The children will be often incessantly crying, they'll be very fussy, irritable, may refuse to take food. Now, when it is affecting the external ear, a very good thing is that the child may be tapping at the ear, or if you try to press anywhere in the vicinity of the ear, the pain will be much more and the child's crying will become even louder. Then all these factors, but if it is something like a middle ear infection, there will be no pain when you press around the ear. So often you may not think that it is a ear infection. But in a middle ear infection, as I told you earlier, because the drum is already bulging, sometimes when the pressure becomes too much, you may find that there must be suddenly some blood-stained discharge coming out of the ear. And after that, the child stops crying. And that's often because the eardrum has ruptured because of the tension. And once the eardrum ruptures, the pain comes down. So you may think that okay, there was a boil and that is why that has burst and the pain has subsided. But actually it may be that the eardrum has burst, and once that tension has come down, the pain has subsided. So these are the different things that you need to look out for. Now, supposing there is a foreign body in the ear, or you suspect that there is an insect, if you shine a torch in the ear and look at it also, you can easily find out. And wax, of course, you look inside the ear and see a thick plug of wax. Definitely means that there is a wax, a hardened wax, which is causing this problem. So all these are the different things you need to look out for to see whether it is a ear pain. So when you suspect the ear pain, definitely you need to go and visit an ENT surgeon. The surgeon will look carefully into the ear to see whether it is a cause inside the ear or whether it is a cause outside the ear. If it is a wax or something like that, definitely some wax solvents, something to dissolve the wax would be given. But one thing you need to make sure is that after using the drops for a minimum of 1 week to 10 days, you need to go back to the doctor to get the ear cleaned, because just using the drops alone may not cause the wax to come out completely. It often needs to be removed. But if it is a viral or if it's a fungal or a bacterial infection, or if it is a boil in the ear, the doctor would definitely give you some antibiotics to control the infection or an antifungal drops. If your child has these frequent ear infections, especially if it is an outside ear infection, please ensure that you do not use earbuds often. Do not ensure that the child is not using fingers inside the ear, because picking in at the ear, all these things are often causes for ear infection. But if it is a middle ear infection also, again the doctor looks inside, sees that the drum is congested or sees that there is some perforation already, antibiotics are definitely given. But ensure that you do not blow the child's nose hard. And if there is an existing nasal infection, some cold or sinusitis, that will also be taken care of, because the doctor will definitely give you something for the reducing the infection. If the child is able to do steam inhalation, it would be good, because it would help to open out the tube. So ear infections, all these external and middle ear infections are taken care of. Next, if the doctor does not see any cause inside the ear, then definitely they will look inside the throat to see whether there is a tonsillitis or a pharyngitis or even a small ulcer inside on the tongue, which is causing all this pain, or a dental infection. Whatever the causes, that is also treated accordingly. And then definitely you will find that if it is an ulcer or something like that, definitely just some soothing ointment on that and the pain will definitely come down. And if it is a tonsillitis which is recurrent, that also has to be managed accordingly. Antibiotics in the acute phase, and if it is very recurrent, you may need to take out the tonsils by a tonsillectomy. And definitely if there is sinusitis or an allergic problem, the child has to be given something for the allergy. Like if there is if the child is at least about 6 years, a nasal spray. If something less, child is only 2 years or less, some other syrups, anti-allergic medications which are given to control the allergy are done. Other measures to control allergy should also be looked into and the parents must make sure that the child is brought up in an environment which is not where he or she is not susceptible to other allergens. Now if the child has had one attack of ear pain, as I was telling you, there is every chance that your child can get this again. So there are certain measures that we need to take to make sure that the child does not go through this pain again. Most common, like I was telling you, is if the child is being bottle fed or breastfed in the lying position, ensure that that is not repeated, because in small children, the tube from the behind the nose into the ear is much smaller and horizontal, so that when the child is fed in a flat position, there's every chance that the milk can regurgitate straight into the ear. As the child grows bigger and we become an adult, the tube becomes more elongated and becomes more vertical, which is why there is less chance of any infection in the adult period. Secondly, a lot of parents feel that the ears need to be cleaned often. So they always make it a point to use earbuds and clean the ear. Please desist from using any earbuds, because earbuds, even though you are using it with all good intentions, when you use the earbuds without your knowing it, there is any wax in the ear that gets pushed towards the drum and can cause pain to the child. And sometimes, even though you're not aware of it, you may cause minute abrasions inside the ear canal, and these abrasions can get infected and the child can get an infection in the ear. Again, if the child is having a nose block or a running nose, please don't ask the child to blow the nose, and please desist from blowing the nose of your child. If the ear block is very bad and there's a lot of nasal discharge, just ask your baby to take it into the mouth and spit it out, because then there is less chance of the infection going into the ear. Another very common thing is that we need to do is that if there is a small insect or you suspect that some insect has gone inside, like an ant, and the child is howling, instill a few drops of warm water. Don't use cold water, because if you use cold water, it can cause the child to become giddy. Just use water either at room temperature or slightly warm, not hot water, slightly lukewarm water. Instill a few drops into the ear. If it is an ant, it will help to kill the ant, and once the ant dies, the pain will come down, and after that you can just take the child to the doctor who will take it out for you. Now sometimes if it is a slightly bigger insect and you're not able to you're not able to kill the insect, sometimes even shining a torch into the ear, the insect might come out attracted by the light. So these are two measures that we can try in our home to clear the insects from the ear. Of course, it's a very big insect like a cockroach inside. Definitely there is nothing. Maybe you can instill a few drops, some water, lukewarm water, to kill the insect. But other than that, I don't attempt to take out any foreign body, any insect or anything, or any other foreign body which you see inside the ear. Because if you try to take it out, you might often damage the ear, and that again can cause a problem, because later the drum can get ruptured. The allergic children, you need to be sure that your allergy is brought under control. Most common cause for that is by using that the child does not use any cotton mattress or cotton pillows, because cotton is often a cause for allergy. And the bed sheets should be washed. Bed sheets and pillow covers should be washed in hot water and changed at least once a week. And if the child has been using blankets, woolen blankets are often a cause for allergy and may result in persistent nasal block, which can cause a ear infection. So avoid using woolen blankets. And if the clothes within the cupboard smell of have a musty smell, please use some camphor or something like that inside the cupboard, which will reduce the humidity inside the cupboard so that that musty smell is no longer there. Because all these things, the musty smell indicates just that there is some fungal organism inside, and that can again cause allergy for the child. So, dental hygiene, very important, especially brushing the teeth twice, especially at night when you give children chocolates, because when there is dental caries, again ear infection or ear pain is quite common. With these simple measures itself, a lot of ear pain can be taken care of at home. And it is up to you parents to ensure that the crying child becomes a smiling child again. I am Dr. Ranjini Raghavan, Senior Consultant ENT Surgeon, Sunrise Hospital, Cochin. You are watching me on webindia123.com.